infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, are the COVID deaths undercounted, as many believe, or are they overcounted, as others think? Well, my guests today have the opportunity to look at a sample of death certificates in Florida, and she is here to discuss what she found. So joining me today is the co-author of the article and the editor of the Alachua Chronicle, Jennifer Cabrera. Hi, Jennifer, and welcome to the show.
Thanks for having me.
You bet. Well, since the number of deaths that are being reported that are caused by COVID is quite high, let's start out with the various guidelines for filling out a death certificate. Can you describe in detail what the procedures are for reporting? Because I suspect many people don't understand it.
Sure. The CDC has guidelines for the certifying physicians and medical examiners who fill out death certificates. And the goal is for anyone to be able to read that death certificate and be able to clearly understand what led up to the death. So there's part 1 and part 2 in the cause of death section. The part 1 is supposed to describe the immediate cause of death, and it's supposed to work from the bottom to the top. There's 4 lines, A, B, C, D. So for example, you might have, in their example that they give in the handbook, line D might be atherosclerotic coronary artery disease. Line C, which means that caused, line C, coronary artery thrombosis, which caused line D, acute myocardial infarction, which caused line A, rupture of myocardium, which is the final cause of death. And it's supposed to also give kind of a time frame for how long these things have gone on, months, years, days, hours, whatever. So you should be able to follow starting from line D up to line A. So a typical death certificate for COVID might say line C, COVID-19 infection, line B, COVID-19 pneumonia, line A, ARDS, acute respiratory distress syndrome. So that would be kind of a straightforward COVID death in part 1. However, in March, the CDC put out new guidelines saying that anyone, if there is any COVID involvement at all, it should go on the death certificate. And so what's happening is that people are putting it, so the CDC actually now is encouraging doctors to put COVID in part 1 for all decedents where the disease caused or is assumed to have caused or contributed to death. And so a lot of doctors are putting it in part 1, even if there's a COVID test. But we're also counting it in this country if it's in part 2, generally used for comorbidities, things that were also going on but that didn't lead directly to death. Now, the WHO says if it's in part 2, it should not be counted. But the CDC says if it's in part 2, count it. And that's how we're ending up with more COVID deaths than maybe even the WHO would count. Right.
So that is clearly one of the main problems with filling out the following the CDC guidelines. You had the chance to review hundreds of death certificates in the state of Florida. Can you talk a little bit about your findings?
Yeah, so we had basically a few hours and stacks of death certificates. So we just kind of tried to put them in piles, and we kind of separated them into, for example, if it was only in part 2, we kind of set those aside. And what we found is, at least half are just straightforward, clearly COVID was the final cause of death. And another 30%, most likely, 20, 30, somewhere in there, probably it was a contributor. If it wasn't the thing that caused the death, it probably made the death happen sooner than it would have otherwise. But, we found a lot of problems. We found that about 15% of them just said they had one line filled out in the entire thing, and it just said COVID-19. So there was no description, and you'd see things like a 95-year-old person who had nothing in part 2, no comorbidities at all. And the ones that you can tell, the ones that are carefully filled out will have like high blood pressure, diabetes, history of this, history of that. They'll all be listed there in part 2. It's hard to imagine a 95-year-old. There aren't very many who get to that age without having some sort of other health problems that would end up in part 2. We found that over half of the death certificates left part 2 blank. And that may or may not be a problem. We don't know. This is the kind of thing that we need doctors who really understand this stuff to look at this. And I think some of these should go back to the certifying doctors and say, what really happened here? Because there was a lot of just notes. Things like the CDC guidance says that there should be WHO guidance. There should be no period of complete recovery from COVID-19 between illness and death. Now that says to me, and it says a death due to COVID-19 may not be attributed to another disease like cancer. That says to me that if you had COVID-19 in July and you recovered and then you had a heart attack, that should not be counted as a COVID-19 death. Later, like people say COVID-19 causes heart problems. Okay, fine. But 4 months later, if the doctor thinks COVID wasn't part of what caused the death, then I'm not going to say. You see what I'm saying?
Mm-hmm.
Feel like, how do you know COVID didn't cause it? Well, what I know because the doctor said COVID didn't cause it. And so what we found was that some doctors, it seemed like the doctors are being encouraged to put COVID-19 if there was any positive test, but some of them were pretty adamant that wasn't the final cause of death. They wrote things like asymptomatic positive COVID-19 swab, which sounds to me like a doctor who's saying this had nothing to do with the death. There was a positive test, no symptoms whatsoever. This did not cause the death, but they were encouraged to put that on there anyway. One said COVID-19 6 months ago. That to me is a doctor who's saying COVID-19 did not contribute to this death, but we're still counting them. If COVID's anywhere on the death certificate, we're counting them.
Well, based on just what you said, do we know if the state of Florida has reduced the death count at all?
No.
For any of these reasons? Because I know in, I think it was Colorado, they dropped their death count several months ago. And one of the things that triggered that was a guy that died in a drunk driving incident who happened to be COVID positive, and they made his cause of death COVID positive when it was obviously a massive car wreck.
Right. Well, those over time, some of those have been filtered out. We know, for example, there was a motorcycle accident that was reported in the Orlando Sentinel. That one was later removed. I saw one that happened at Shands in Gainesville, and it was a guy a 35-year-old who was struck by lightning, fell off a roof, broke his back, and died in the hospital, but tested positive in the hospital,
right?
Like as he was dying, right? But that one was also later removed, as far as we can tell. So yes, some of these are later removed when they come to the attention of the people that are in vital stats as they review them. And it's very common. I track the deaths every day in Florida, and it's very common, almost every day, multiple deaths are removed. And it's never clear why. We don't ever know which ones are removed or why. Sometimes it looks like they're just changing a date. Like there'll be one, you might have one, like even in October, we would have one added on July 15th and removed on July 16th, for example. So you can say, they probably just changed the date, but we don't know. We never get any explanations. And it's really time for a very serious review of the death certificates to really understand the point of this is not even that anybody's doing anything wrong, but the point is to understand who is at risk from COVID, who are the people that are dying. And, for what we saw from our review is that mostly it's people who are already frail or sick or, a good part of them had cancer. We found that about 10% of them had some sort of like adult failure to thrive, malnutrition. Mm-hmm. So these aren't typically people, in the prime of life being struck down. And I think that's the most important thing, is to understand who dies, is that it's not it doesn't hit everybody over the ages, it's not an equal opportunity virus. Hardly ever affects children, doesn't affect young people much, definitely hits older people. And so, understanding who's at risk and understanding all of that really can inform our policy rather than the kind of one-size-fits-all policies we've been following.
Yeah, I agree. Now, after doing your research into the death certificates, and you reviewed about 700 of them, your conclusion, what did you make? Is it they're undercounted or overcounted?
Well, it's obvious to me that they're overcounted. Mm-hmm. Based on the fact that we changed the way we're counting them in March. If we were counting COVID the way we count flu, like we like to compare the fatality rate of COVID to the fatality rate of flu, right? That's a big compare. Everybody's like, is it like flu? Is it not like flu? Right. Flu is about 0.1%. COVID's, we think now, somewhere between 0.15 and 0.3%. Even that is overall, like it's very much depends on your age. But the point is that, we don't count flu the way we count COVID. We don't test everybody who goes into the hospital for flu, everybody who's in a nursing home for flu, everybody's in hospice for flu, and then when they die, call it a flu death. And that's what we're doing with COVID. Yep. So you can't compare it to anything else because of the way we test and because of the way we've changed the reporting. COVID reporting is done like no other disease reporting.
Yeah. And did the CDC ever explain why they changed the reporting?
They did not. They never gave a reason as far as I can tell. And I think it's possible that this was just a public health. We want to know how this is spreading. We want to know who has it. We want to know where there are outbreaks. I think at the beginning they were just trying to say, we want to see where this is spreading so that we can track it down and put out the outbreaks. But, we've gone so far past that, and we've gone, not only are there we don't really have groups of outbreaks anymore, it's everywhere, but also, it's gone from information to statistics that are being used to pass all kinds of laws and completely change our society.
Yeah, and that really gets me into my next question is, the majority of the media, they really put a lot of importance on the raw number of total cases. And that number is huge. And I see why they're doing that. But they're not stressing very much like the percentage of hospitalizations, the percentage of fatalities. What do you believe is the importance of reporting the raw numbers of cases?
So I report them for my county every day, and I actually get some pushback from my readers because they're kind of tired of it. But I do think it's important for everybody to understand the exact the data. What does the data say, so that when their local politician says, it's out of control, it's growing exponentially in our city, we need to close this and close that and reduce this, that you have the knowledge to say, no, I'm looking at a graph. It's not real. It might be mildly increasing, but it's not increasing exponentially. It's not uncontrolled. There's absolutely no evidence for any of that generally. So I think that the more knowledge people have, the better. So I do track cases, but the fact is that cases vary with the number of tests, and percentage positive varies with the number of tests. So you'll see that if you do a 7-day average on the percentage positive almost anywhere in Florida, it's pretty flat. It is slightly rising, and we have some theories about that, but it's pretty flat. But what you see is that on a very low testing day, the percent positive is going to kind of jump up. And on a very high testing day, the percent positive is kind of going to go down. Mm-hmm. So everything varies with the number of tests on a given day, and the number of tests on a given day varies all over the place. In Florida, we might have, 100,000 tests, 120,000 tests, or we might have 40,000 tests. It's just, it's huge variance. And so the number of tests is on its own is a completely irrelevant number. But also, we know that PCR tests pick up any exposure to the virus in the last, 60 days. You could have had it 2 months ago and you could still test positive. You could test positive because there's a fragment in your nasal cavity. So we know a lot of these are asymptomatic, and what we don't know is whether they're actually infectious, because the PCR test doesn't tell us that. So we really don't know what cases tells us. Again, the definition, a case has never been strictly diagnosed from a positive test. If you think you have flu, you don't go to a drive-through flu testing site and they go, oh yeah, you have flu. You go to your doctor. Your doctor looks at your symptoms. And then they say, oh, you have a sore throat. I'm going to give you a strep test. I'm going to give you a flu test. They look at, it's a picture. It's your clinical diagnosis. There's a test result. Then they say, well, here's what the test said, but regardless of that, here's what you should do. We're not doing that. We're just testing random people. These tests aren't even designed to be used on asymptomatic people. They're very inaccurate when used on asymptomatic people, but nobody cares about that. We're calling them cases.
All right. Well, any final thoughts on the death certificates or any other topic related to that?
I would just say my message to everybody is understanding that these PCR tests are very sensitive. They pick up people that aren't infection, but that number carries through, because if you go to the hospital and you've had a COVID positive test at the hospital or before you get to the hospital, you're now a COVID hospitalization. And if you die, you're a COVID death. And that infects the whole, it cascades through the whole system. So understand that all the stats are inflated by the inflated PCR tests.
All right, very good. And the article is Death Certificate Review Raises Questions About the Official Number of COVID Deaths. And that's published in the Alachua Chronicle. And I'll link to it in the show notes when I publish the podcast. And I want to thank you, Jennifer Cabrera, for sharing your research and your thoughts with us today. I appreciate it very much.
Thanks so much for having me on.
You bet.